years is when we go to a doctor, nobody knows what to do with us. There's never any medical person out there who sees us. We're also spread out around the country. And my doctor only knows me, and he barely knows me because I never want to go and see him because he never seems to be able to give me any help. And so through HealthLink, we have a coordinator who's connected to experts of thalidomide around the world. And if I have a problem like taking blood, or having my blood pressure taken, or the multiple problems that we have, we can phone up our coordinator and ask them how to go about getting this. And then with their assistance, they help us speak to our doctors and our consultants. The consultants quite often prefer to listen to other experts. And through that communication, we can get in the service and needs, medical needs, met through the NHS, which as I said, is our National Health Service. Okay, so the Thalidomide Trust. We received an annual allocation in 1973 when the trust fund was set up. We received a small lump sum payment, and the rest was put into trust to look after us for the rest of our lives. And this we call our annual allocation. Each year we receive money that is put into account for us. Until 2004 we were taxed very heavily, but we're not taxed anymore. So we can now take that money out as a lump sum and do with it as we wish. 2010 to the end of 2009, as you know, we took the government on and we received an apology and we received some money into the trust. They gave money for 3 years to be allocated out each year, and we can receive that money at the same time as we receive our annual allocation at the beginning of the financial year. For an average person, from the government grant, that's £18,000. And as I said, under the annual allocation for the average person, that's £24,000. But bear in mind that the worst affected will receive twice as much, and the least affected will receive lesser than that. But the average total for the average thalidomider is £42,000. This money we do not have to declare when it comes to claiming benefits from the government. So we have a benefit system, and it's very complicated, like everybody else's system. Obtaining benefits depends on whether you receive other benefits, and the criteria changes from one benefit to another benefit. So generally, you're only recognised as a disabled person if you can't walk or you have a lower limb problem. It very, very rarely includes upper limb problems. And actually, many social workers themselves do not understand the system. So the greatest controversial benefit we have in the UK is something called disability living allowance. And this is an allowance that's given to disabled people to assist in the extra cost of living with a disability. And it's broken up into 2 parts. It's broken up into care, and it's broken up into mobility. It's not means tested. Any disabled person with a physical disability, a mental disability, somebody who needs supervision can apply for this. But it does require a medical examination. So what can you get with it? Well, you can get help with washing, dressing, eating, going to and using the toilet, communicating your needs, etc. If you have any of those needs, you have to write them down. It also includes dialysis, and if you're not able to prepare a cooked meal. It also includes if you need help going to the toilet, and it also includes if you need help at the night time. But it does not include help with dusting, vacuuming, mowing the lawn, and other general household domestic tasks. So how do they give that to us? They make an assessment on whether they consider you high, medium, or low. If you get the low rate, you can get £18.95 a week. I have no idea where this figure came from. They plucked it out of absolutely nowhere. The same with the middle rate and the same with the highest rate. So, the other part of this care package is the mobility component. And there's only 2 parts of that. You either low need or high need. Again, if you've got upper limb disability, they don't consider you any need whatsoever. So if you receive the higher rate of mobility, it entitles you to another benefit, which is the car system. And it's a system that's been set up called Motability. Under the Motability scheme, you can use the money you get from the mobility